Hello and welcome to today's presentation on connecting to community partners of South Florida's behavioral and mental health services. Our speaker today is Jibby Ciric, and I'll tell you about her bio. She's the Vice President of Child and Family Mental Health Services at Community Partners. She's completed bachelor's in public health, master's in mental health counseling, and doctorates in psychology. She educates and trains mental health professionals entering the field, as well as creates and manages innovative programs related to inclusion of the most at-risk communities in Palm Beach County. As a master's graduate, Jibby spent time in Europe working on after-war efforts in former Yugoslavia. Currently, she holds seminars in Europe, educating on effects of trauma on socio-emotional, neurological, and physical development. She's involved in a number of committees, such as the School Health Advisory Committee, Opioid Crisis Task Force, and Palm Beach Medical Society Services Board. Jibby's commitment and dedication stems from a young age as a member of the Serbian National Track and Field Team. So I'm really excited that we have such a distinguished speaker today, and I will go ahead and hand it over to her to share for her presentation.
Thank you, Catherine. It's sometimes when I read my bio, I never like writing those, but thank you. So anyways, thank you everyone for joining, and I'll be happy to share all the services that our agency, Community Partners of South Florida, provides. And so I've been with the agency for 17 years and actually started as a therapist with Community Partners of South Florida and was a therapist for first 6 years of working with them. But my first love were corrections. So I was a therapist at level 8 and 10 correctional facilities. So I've been in the field for about 20 years. However, for the past 17 years, Community Partners of South Florida has been my home. As Catherine said, I will share the resources that we have within our agency. We do have about 40 distinct programs, and we usually group them in the larger kind of programs that they do, the impact that they do, and kind of like the population that is served. So what I will do, because it is many programs, I will share, I will kind of break them down into service areas and kind of the needs. So Community Partners, you will notice from when I go over the programs that we very much believe in that coordination of care and holistic approach. Hence, all our services being kind of coordinated in care, and many of our clients receiving multiple services, because we do believe impact that we can have on people, places, and the community in itself. So to kind of start off, another thing that I do that Catherine and I spoke, I always go on our website, because we did work on our website to where the services can be kind of talked about in a specific area. And that way, everyone, instead of PowerPoint, where you would have to reference it every time, this way you can actually go back to our website and get all the information and contacts that you might need, as well as make a referral. So I will share my screen now, and I will start the presentation. So, okay, let me do this. It's going to end up, no, go back. It's underneath here. Oh, I'm sorry. I forgot to close this one. Hold on. Just a second. I have to stop. There we go. Why is it doing this? I'm sorry, guys. Give me just a second. Click again. All right. There we go. It got stuck on the Zoom. So as I said, Community Partners, it's very much believes in that holistic approach and coordinated approach to services that we deliver to our residents. Most of our services, if not most of our services from both health, which is mental health services, and housing, focus on the whole Palm Beach County. So to start with, I will start with mental health services. For purpose of our website, we call them health services. And it was, we noticed after doing some of the exploration with the community and things like that, people are really get stuck in that sense of mental health and behavioral health. So we call them health services. For mental health services, we split our programs into services for adults and then services for children. Many of them, so all of our programs deliver services for both children and adults. Again, for the purpose of the website, we split them up so people are aware and can go, residents can go and kind of have that distinct difference. But when it comes to our services on the child, our program is called Child and Family Mental Health Services. That covers all kind of counseling and wraparound services. So I will talk first about that program. All our services for adults and children, if you click on either one, you will get to what we provide. For adults, it's outpatient therapy, targeted case management, and high fidelity wraparound. And I'll speak to that. As well as for children, we do have additional programs that are, you will notice that we have, in addition to outpatient and targeted TCM, targeted case management, and high fidelity wraparound, we also have school-based therapy programs and psychiatric services. So to speak sort of in general sense, all our referrals that come to our agency, they come through our website, which again, it's right on, you will notice that it says cp-cto.org. However, if you type in cpsfl.org, you will get to our website, which is basically Community Partners of South Florida.org. And it will get to our website. All the referrals are made through our website on submit a referral on the top corner, in the top, almost like a little bit up to the right or middle corner in green. So all our referrals we receive come through this portal. We have our intake department that receives all the services, all the referrals for services. And basically our intake department holds 2 intake coordinators. They're actually certified in care coordination, and they make sure to follow up with all the referral sources, with all the clients. So if there is, we truly believe in that warm handoff. So we believe that it's not just technical, receiving the referral, checking the insurance, and just moving on. We believe in following up, and if we have any difficulties in engagement, we know that some of our residents, there's a stigma to mental health services. There are many other issues that maybe pose as a barriers to engagement in services. So if needed, our intake coordinators would contact both the referral source and the person being referred to follow up on any questions or anything that they might need that was not originally on the referral. We also, our intake coordinators, they process the referrals, and further, our intake department also has licensed mental health professionals who complete the intake. What intake basically is the initial assessment that is called biopsychosocial, and that is the way of just interviewing the individual and making sure that diagnosis is confirmed and they receive the diagnosis that is appropriate. So all our intake therapists are licensed. After that, so we believe in that, I almost believe in that effort of continuously, once the client is referred, no matter if they're referred for one service or multiple services, all our staff continues to assess for any other resources needed. As we know, we always talk about need for more resources, but we also know that the different individuals are aware of different resources. So what I might know about resources, my intake therapist might know more than I do. So we continuously assess for what availability there is in our agency as well as community for clients being referred. So our intake therapists, once they complete, they're not just looking at those specific services related to mental health. If the client needs any other services, they will offer first to the client if they're interested, such as housing or community resources such as bridges, and make sure that if they benefit from that, they will present that to the client. If they're interested, they would do that referral as well. Once intake is completed, if the mental health services are needed, they're most likely referred from there to our outpatient or our high fidelity wraparound or targeted case management. And I usually talk about those 2 programs in combination because they're very much kind of, they work together in probably 70 to 80% of the time. So our outpatient services department is the biggest department in our agency, I believe. We have 3 teams of 8 therapists, and they're either working towards their licensure or they might be licensed also. We provide free clinical supervision to them working towards their license. They have We very much believe in supervision models. So we do have both clinical and administrative supervisor, as well as the support of myself and the director of the department. So outpatient therapist, if the client needs outpatient therapy, we provide therapy, as I said, through the whole Palm Beach County, from Boca to Tequesta, from Coast to Glades. We have, as I said, 24 full-time therapists, and we also have some contract staff. In addition to clinical and administrative supervision, all our staff goes to 3-week onboarding, what we call academy training program. So our staff, we are sure that not only do they know how to do standard paperwork and everything that everyone talks in our field about, but we make sure that they're trained in all the partners we have in the county, people that they might run into while working with a client, some modalities that they need to be aware, trauma-informed care, 2-generational approach. So they're extensively trained before they go fully into the field. If assigned to the once referred to a therapist, the client is assigned to one of our therapists for ongoing therapy. Typically, most of our clients are seen once a week for 1 hour of therapy. And we provide services, as I said, throughout the Palm Beach County, but the way that it works, all our therapists have designated areas. So they don't run throughout the whole county. They either have, like, you know, our staff living in Delray might get like Boynton Beach and Delray. So they're specifically designated in specific areas of the county. And we do provide treatment in both in Creole, Spanish, and English. In addition to on-site services, meaning going to most, so we are monitoring that, and we do provide both in-person and telehealth services. So it is up to the clients and client's choice whether they would like to be seen in person or via telehealth. Excuse me. We're seeing a trend to where since the last October, the telehealth services have decreased and in-person services have been increasing. So it's interesting to see that. We were hovering beginning of 2022, we were hovering around 80%. Just in January, it dropped below 70%. So we are now at like 66, 67%. So it's interesting to follow those trends. As I said, it's always up to the client. It doesn't, again, as we said, it doesn't have to be exclusively either telehealth or in person. It can be mixed, however, whatever works for the client. In that sense, throughout all programs, we are very much client directed. So we see clients at home, school, work. As I say, sometimes it's even McDonald's or library, local library. They're more than welcome to come to our offices as well. We just redecorated and redid our therapy offices. So I think, my personal opinion, they look very nice and very welcoming. So we have all those options available to the client. So besides that, some of the clients are seen even twice a week, and our therapists are also trained to coordinate care, hence the academy, with any of the other providers such as school or ChildNet, DCF, whoever is involved in a case. Now that leads me into the targeted case management or high fidelity wraparound. So a lot of times, many of our clients need additional resources or advocacy for the justice system, juvenile justice system, child welfare programs, IEP in school, or just, you know, legal struggles such as being undocumented or anything such as that. In those cases, or just are in need of extra resources in the community. In many of those cases, or all the cases that is needed, we do refer to targeted case management or high fidelity wraparound. The reason why we left targeted case management is because many people haven't heard still about high fidelity wraparound. And what it is in plain language, as I call it, it's basically wraparound is target case management on steroids. So what that means, all our targeted case managers are working towards certification or are certifying high fidelity wraparound, meaning that wraparound is much more intense than just typical case management. They see the clients in many cases once a week versus once a month or every other week. They have mandatory family meetings. And wraparound, really the model of it is it aligns with all our other services, meaning it's very persistent, it's very client directed, it's holistic in approach, it believes in client strengths, and it also believes in natural support systems. So they kind of embrace all those aspects and work with the client on getting them the resources, maintaining them the resources, and everyone that is working with the client being on the same team, same page, and kind of working together versus pulling the client in each and every direction because of the justice system needs certain things from the client, child welfare needs specific things. So we try to kind of align that because a lot of times people do get overwhelmed with everyone that is involved in their care. In that sense, therapists and wraparound facilitators work hand in hand in this case, and often do consultations and family meetings, and to make sure that everything that they need, like summer camp, summer school, whatever is needed for that client is there for them and available. We also have, we just started in August, our psychiatric services for children. And the reason that is not on adults page is because we are just now working on hiring and onboarding a psychiatrist for adult services. So that is definitely coming. But right now we do have a psychiatrist on our staff, and he has availability of 20 hours, and currently we do have openings for psychiatric services. I always say that because I know that psychiatric care is in high demand in this county, especially for children. So if that is needed, again, referrals, it's done, all our referrals are done through websites, so submit that referral, it will be expedited in that sense. I'm very happy to say that when it comes to wraparound and outpatient, as we've been talking lately with all our partners, there is an ongoing wait list for all the services, and many of the providers, including us, had long wait lists. Well, we were very fortunate to be able to hire many staff, and we are close to being very close, 1 or 2 staff off from being fully staffed. Therefore, our wait list is down to 2 to 3 weeks of assignment. That does not include psychiatric services. We have immediate availability for psychiatric services. So those are for when it comes to psychiatric services, we do provide the only time the client it really does need to come to the office is their first psychiatric evaluation, and that is because of the vitals. So our psychiatrist, our office manager has to complete vitals to assure that, if there is a prescription needed, that it's appropriate for a doctor to prescribe. The rest can be done via telehealth as well, or they can continue coming to the office. We have a telehealth because our psychiatrist is not always in the office. So we have a telehealth set up at our office if they don't have availability to engage via technology in their sessions. So those are our 3 major aspects of mental health services. However, we also have a school-based therapist. We have our therapists that are specifically based in 13 schools throughout the county. And they are all the referrals that come for staff that is placed in schools are specifically through those schools. So they only accept referrals from schools and see the clients in school. They're based out of school. So that is a very kind of place-based program. But the other 3 services, as I said, are available through the whole community. When it comes to child and family mental health, or mental health services, we do accept all Medicaid HMOs, as well as we provide services to all uninsured clients or those that are underinsured or maybe they have a plan, but they don't have behavioral mental health covered under that plan. We are also able to provide services to those individuals as well. So basically, we cover a large group of our residents. The only ones we don't is private insurance. We only accept United Healthcare or Optum as from the private group of insurances. So we are able to see the clients with with that insurance as well. But all the Medicaid HMO, or if the clients do not have insurance or are underinsured, because sometimes the services, especially when it comes to psychiatric care, can be very pricey if you don't have a coverage for that. So we make sure that is available to the residents of our county. So those are our child and family mental health. Again, we are working on getting the adult psychiatrist, so that is going to be added, and all the services will mimic except the school-based programs that are very specific to the schools, as I said. Now, our second area, as I said, Community Partners of South Florida, we have 3 distinct areas that really work together in delivering the services to our communities, to our clients. And the second one that really works hand in hand with child and family mental health is our housing services. So housing services are also available to all the residents of Palm Beach County. And most of the services are now available via like telehealth platforms or via Zoom, or it's a bit different for them because they don't have to follow to the extent they can do it via Zoom. Many of the services, so they also have went both kind of telehealth and in person. You will notice that there are different programs. The way that I group them is the first-time homebuyers program, our financial education and coaching, and then our affordable rental programs. The reason why I do that is because they split them up on a website with, if you want to chat with housing experts, but they also have homeowners education. So the way that the first-time home buyers start, it's with education counseling. And then it goes into down payment assistance and post-ownership education. While all of that is going on, so basically during the down payment assistance, match savings program is available to those clients. So basically a couple of these links so 4 of these links, meaning education, down payment, post-ownership, and match savings are all part of the first-time home buyers. If you click on any of those, they will lead you to how to get started, which will take you directly to the to how to get a hold of our first-time home buyers expert. So if you go to any of the services, for example, homeownership education, it kind of explains in details that I will talk about it, and then how to get started. Again, in any point where you click how to get started gets you to the email and the phone number of the direct contact for that specific program. Now, to speak a little bit about the first-time home buyers. First-time home buyers is available to all the residents of Palm Beach County. And I do believe they changed the maximum amount of money person can make. I think it's 70,000 at this point, or 75,000. I'm not sure, but that is the top to where they can participate in our program. The way that it goes is that anyone can contact, as I said, how to get started, contact the individual, and they would start the process. First part of the process is home ownership education and counseling, meaning educating clients on, which I definitely needed before I bought my first place and house, on down payment, how that works, down payment works, how the closing costs work, the credit, how that works. So educating them of the whole process of being a home buyer, how to get started, right? Getting a loan and all of that that is needed to even offer on a house. Once that is completed, they will start working on, and if everything's clear, if they need assistance now during that period, if they notice that the client does not have a credit score of what is needed to buy a home, they will then redirect them to financial education and coaching that I will be talking about. But if everything's okay and now the client is ready to move to the next step, they will work on this down payment assistance and match saving, meaning they will coach the client on how to appropriately save the money for the funds needed for to become a homeowner. And in that process, we do have something available, and I do believe that's why the county, because it's different funders for housing program that support the residents of Palm Beach County, but we do have that match savings program account, meaning that every dollar is matched by us that is saved towards the house, and I believe it's up to $15,000 or $20,000. So any dollar amount up to $15,000 or $20,000 on a certain amount the client saves, we match it. So after that, the client is ready. We do work with them through acquiring a loan. So we have a specific individuals in our loan department. We used to actually provide loans to the clients, but we now partner with the banks, which can be very intimidating. And we have specialists that work with the clients once they're all set. They have their savings. They went through all the education, and they work with them on the whole process of closing on a house. They find the bank, the appropriate rates. All of that is done within our housing department through that program. We also, after the house is bought, we do have post-ownership education, meaning specific things related to taxes, to insurance, to what is needed, like different, savings for, if something breaks in a house, all that stuff that is needed as being a homeowner. We do have post-ownership education as well. So that is when it comes to first-time home buyers. If at any point during the first-time home buyers, there are some needs identified, or anyone in the county, again, can be referred to our financial educational coaching. So this service is basically, as I say, again, everything is kind of like written down of all the services we provide, as well as how to get started, who to contact. So some of the services under our financial education and coaching is IDA, or Individual Development Account Program. That is the match savings program that they work with. We do have financial coaching. So it's counseling on maintaining good credit score, resolving any of the credit debt, managing budgeting. So all of that is done by our specialists. They even file when the score needs to be increased. They work with the client as well as the different entities to make sure that everything's processed and done and kind of like litigated, and the clients are in the position to where they can get a better credit score, therefore have a better capacity, financial capacity. We do have financial fitness workshops. Those are monthly educational classes on how to budget, how to maintain a good, balance in your accounts, on credit cards, on all kinds of different things. And that is done in all three languages, English, Creole, and Spanish. We also are prosperity centers. They all, our financial education and coaching services. They also do education and career assistance. So again, many of the individuals that start maybe in education and career move on to match savings and first-time home buyers. So it's constant flow. But I know they work very closely with Career Source on such programs with building resume, if they need any specific skills, enrolling in classes in schools, getting a GED, all those kind of educational and career kind of desires or vision that the client might have. They support them and give some suggestions or ideas. During this time, we have tax assistance currently going on. I know they start setting up in December, and it goes all the way until April, end of April. So April 15th, I think that's when the last day for taxes are, but we do free completion of taxes for, again, anyone who makes now I know it's similar to first-time home buyers. It's $70,000 or $75,000 a year or less. So we constantly, right now, it's done in our building on 2001 Blue Heron Boulevard, because that is in person. So we have people constantly coming every day, and we have available staff that completes and supports them in that process. So those are kind of like the major programs under our financial education courses. Again, all the referrals, you can go directly and contact them under how to get started, or make a referral under submit a referral. Either way works. We will receive those referrals either way. And as I said, under housing, the third large kind of area that I want to talk about is affordable rental housing. So Community Partners of South Florida, we do have Celtic and St. Charles apartments. Those are specifically designated, and Village 1. So that is the third one that we still haven't put on our website. But those three apartment complexes, Celtic Place, as it says, it's in Lake Worth, and it's 8 2-bedroom units for pervasively mentally ill clients. Same for St. Charles, except that it's 11 1-bedroom units in West Palm Beach. So either it's very low rent or no rent at all. And depending on where the client is, they work with them and our case managers, again, with getting anything that they might need, any SSI, SSDI, making sure that all their housing needs are met. And these clients are long-term clients. So they stay there we have clients that have been in St. Charles for over 15 years. So there's every so often there is opening, but not as frequently. Now that's with Celtic and St. Charles. We do have Village One, which is another complex of 34 beds. Some of them are 1-bedroom, some of them are 2-bedroom apartments, and those are for any clients that are at risk of homelessness, that have mental health diagnosis, that need support. So this is more of a shorter term housing, meaning 2 years or so. So most of those clients do stay a year, some stay a year and a half, some use the whole time that they're there. We do have for Village One, we are very kind of team oriented and truly holistic in approach, because we do have layers of support within our organization, meaning they have therapists on property, they have wraparound facilitator there, they have housing case manager there, and the director that oversees the whole process. So each of those staff work on specific needs. So housing case manager works on, getting the employment, possibly working on some other things to get them stable housing throughout the process, and working on any benefits they might receive. Wraparound facilitator works on other resources such as food stamps and making sure they're connected with psychiatrists and, all of those things. And then the therapist continues with ongoing therapy. We also partner with other providers such as Rebel Recovery, Mental Health of America for the ongoing daily groups and things, our other partners in the community. So Village One we do have available beds right now, actually. So that is in West Palm Beach property, right off of Tamarind and Palm Beach Lakes in that area. So there is availability for those beds. So again, if you know someone that is at risk of homelessness and has mental health diagnosis, the referral again can be made on our website, and we will make sure to follow through on that immediately. So besides for our affordable housing, these are our programs, our properties, but we also have our supportive housing staff that we do have contracts with many landlords, private and communities, to where we contract with them for single individuals and families. Again, it's driven by the diagnosis, so they have to have mental health diagnosis in order to participate in the program. But basically, we do have contracts with very lower rent due to the funding that we do receive. And our specialists we have specialists for families that places families in community anywhere in Palm Beach County, as well as for single individuals. They work on roommate matching if that's possible, or individual 1-bedroom, 2-bedroom, depending if it's a family, if they need bigger place, but it works on appropriate for their income and what they can afford, working with our landlords in order to place them in appropriate housing. They also work on any needs that they have related to housing, as well as if needed, they refer to child and family mental health for services such as wraparound and therapy. So you will notice we constantly kind of work in collaborating between all of us to make sure that we support our residents and our clients in the way that they need to be supported. So that is our supportive, that is our part of the affordable rental housing and supportive housing, as we call them. Again, how to get started. You can you can contact, you can email, or you can just make a referral. So we have different ways to reach us. Now, our third area is, and again, housing, most of the services are, so all the services are for low-income families. And it is very driven by the amount of income that individual has. So if they're truly struggling and at this point do not have a job and need support, we're able to provide those free services because of the funding availability that we do have. So the third area, which is our community services, I'll just move this a little bit on this side. It's our community services side. So this area, service area, is fully funded by Children's Service Council, or CSC, as everyone knows. All the services that they provide, most of the programs that we do have under community, I will say that other agency has them too, which I think it's actually a wonderful idea. I always say that with CSC, they never give all the programming to one agency. They always kind of split it between multiple agencies, which I think it's great for learning of what's working, what's not, and kind of sharing those ideas. So you will see that some of the services programs that we do have, some other agencies have them as well. So our youth services school-based programs, we do have we do have a couple of them, meaning we do have, so we do have mentoring programs in 3 elementary schools. We have the basically mentoring and mentees on the move. That's very similar. It's both our mentoring programs, and then our teen outreach program. So about our mentoring program, you will see where, again, exactly specific schools where we provide mentoring. And then a little bit about mentees on the move, meaning that we do constantly also, we're asking for anyone that's interested in becoming a mentor to contact us as well. So you can have the application here and whichever one program you would like, but both of them are connected to mentoring. And then our teen outreach program. So we are based in schools, both middle and high schools. You will notice also that mentoring is specific to mainly elementary schools, to where teen outreach program is designed for middle schoolers and high schoolers. So the reason why I always say we are not the only ones that have teen outreach program or any other program the CSC does fund other agencies to provide the similar services, is that a lot of times people are like, well, you only have like 5 schools that you provide this program. What I always did is that we have that ability to always ask, because even if you email one of our director from teen outreach program and you have someone in Atlantic High, they will tell you the contact person in Atlantic High, because they always work together. Even though they're not with our agency, they have their meetings and they collaborate as well. So these programs, the teen outreach program is designed specifically for middle school and high school children. So the teen outreach staff goes to school once or twice a week, and they do, the students are mainly identified by the guidance counselor, teachers, or someone within the school, but it can be identified by a therapist. We have therapists that identify that have a child that they provide services in Forest Hill High School, and they know that there is a teen outreach program there, so they would contact and make a referral. It's designed for at-risk children, at risk for maybe for using illicit drugs, or for for failing in school, or not being on a track to graduate, or maybe it's high-risk sexual behaviors, or anything that puts the child at risk. And they participate in the reason why I'm smiling is because Teen Outreach Program did a presentation for our all staff, and I thought that they have the best activities to engage. They engaged me. So they're really good in the activities that they do. They also do a lot of volunteering in the community with the children. They went to Big Dogs Ranch one year, so they're very engaging with the children that they serve. So those are our mentoring and teen outreach. Our community side also has the positive parenting program, which is we call traditionally Triple P. And it's an evidence-based program out of Australia. It's a very structural program for specifically geared towards parenting. It goes in levels depending on how many behavioral issues there are at home. If it's only one, then it's a Triple P level 3. If it's multiple, then it's level 4. And I believe level 3 is 6 to 8 session, to where level 4 is 10 to 12 session. Again, the reason why they have limit to the sessions, unlike child and family mental health, to where we can see the client for as long as the client needs us, is because it is that structured, very much geared towards the behaviors and teaching, and all the staff is fully trained in Triple P. We have 3 teams working with children, working with teenagers, and working with developmental disabilities. So we have all those 3 teams available. As I said, all services are funded by Children's Service Council, so they're free to anyone in Palm Beach County. I do believe that Triple P is same like child and family mental health, to where they go to homes as well as do telehealth sessions. I know because of some of the modeling behaviors, because it's very behavior structured, they need to, it's much more effective if they do engage in person with the family. But many of our staff on our wraparound and therapy side, in order to focus on some other things, they are able to engage and then refer to Triple P just specific to parenting. So everyone qualifies. As we're running out of time, I will speed up, but I only have 2 more things to go over. And one of the programs that's really dear to me because it stands out of all our services, it's so different, it's our Safe Kids program. Our Safe Kids program, basically the main thing that they do is twofold. One is they educate anyone in the county about safety surrounding the water, fire, anything safety related. Our team goes out and they work with fire departments. They have a lot of partners in the community and they do constantly that education. Other piece of that, they also have educational lessons. So if anyone's interested, they can come to schools and talk about that. They do it online. They have everything. And if you are interested, you can click on Safe Kids. And there is how to get started. Kathy Wall is actually, she is the one contact here. She's our director of Safe Kids. Other piece that Safe Kids does that is wonderful is they provide free car seats to all the residents of Palm Beach County. So if individual is not in a place to where they can afford, car seats are expensive these days. So if they are not able, not only do they provide the car seat, but they do the safe installation of a car seat. So this goes if a family has a car seat, but they don't know how to install it. They can also come, they can schedule appointment and the staff of with Safe Kids will install it professionally. I had a child a year ago and Safe Kids did install my car seat. I did contact them. So I was like, I don't know how there's too many straps, too many pushing, pulling. So someone help me. So they're there for anyone to be supported in car seats. They also do like free helmets, riding to school, a lot of cool activities, but they're awesome. So if you know someone that needs their service, please reach out to them. And the program that our largest program under our community services are Bridges. So Bridges is so basically it's also funded by CSC, as I said, but we share bridges. There are 10 bridges in our community. They're placed in specific areas of Palm Beach County at the at-risk areas of Palm Beach County. And we are sharing it with Children's Home Society. So 5 bridges are ours and 5 bridges are under their roof. So the bridges under our roof are bridges of Riviera Beach, bridges of Highland, Lake Worth, Belglade, and Pahokee. And as you click, you will notice they have a description. They do much work with children like 3 to 10, and anyone that lives in that city is welcome to attend. So they do a lot of prevention, engagement. They have wonderful like father classes. They do ASQs assessments. They do navigation for the residents. They have all kinds of different activities for each of their sites. Again, we have 5, but I always tell the staff, if you're interested, you can click also on the links, on our link, if you go on our website, and it will take you to that bridges under CSC. And what you can do is check their monthly calendar. So you can, if anyone's interested in living in the city of where bridges are present, they can click on their calendar, February, and all their events will come up. So these are their events for the month of February. Now, as I said, I clicked on bridges of Riviera Beach, but if I just remove Riviera Beach and go to bridges, you will notice it will take me to all of the bridges sites. So even the ones under CSC, under CHS, which is Children's Home Society. You will notice that Boynton Beach is not under community partners, but Lake Park, Lake Worth West, and Northwood. Those are under, but you can go to all their calendars and look at their, as well as their locations. So, oh, now I lost my site again. So those are, again, let me just stop sharing because I have to go back in. So those are the programs under community partners. Let me go back. Okay, cool. That I wanted to share with you and kind of discuss. As I said, all our programs are on our website and you can go directly to client services, and everything that I spoke about is there. You can also look at description. You can contact the people directly from the link, or if you want to make a referral, you just click on submit a referral. And most of the services that are for the whole Palm Beach County are on, some fields are required for our purposes of checking the insurance and things like that. And then all the services that are available through the community are on here. We also have a SOAR program that I didn't mention, and I will just take a very short time because many of our residents living under our supportive housing, as well as our clients under child and family mental health qualified, but the process is basically acquiring SSI or SSDI benefits, disability benefits. And it's a long process that requires application, a lot of paperwork, interview. So we do have a SOAR specialist that specifically works with the client hand in hand in the process of getting him to that place of receiving benefits. So collecting the paperwork, submitting the paperwork application. So if that is someone that you know that could possibly qualify for those benefits, please also make a referral to our agency. And those are the programs of Community Partners of South Florida. Any questions? Oh, 12 minutes to